Health Department, we have Community Health Coordinator Ann McClure. Good morning, Ann.
Good morning.
Welcome back.
Thanks.
And it's a special month at the Health Department dealing with infant and maternal health.
It is Maternal Infant Health Month, yes.
And we have, and I think this community, along with the Health Department, have a pretty strong focus on improving our statistics when it comes to maternal and infant health in Jackson County.
I would agree with that, and one of the programs that we have at the Health Department is our Maternal Infant Health Program. It's a free home visiting service to pregnant persons and families with children under 12 months old in our community.
Pregnant persons.
Pregnant persons.
That's right.
That's politically correct.
It is.
Pregnant persons.
Good. Yeah.
Yes.
Heard that
Yeah,
one.
nice catch.
Very good.
Yes.
Very good. How do you apply?
Anybody with Medicaid coverage is
Okay.
a benefit of their health insurance. They can refer themselves. We get a lot of referrals from our WIC department as
Okay.
well, and also the health plans that we contract with that provide the service. So during pregnancy, we can offer 9 visits during a pregnancy, up to 9 visits, and we offer nursing and social work services. And then after delivery, if the family's satisfied with services and they'd like to keep working with us, which is majority of the time. Sometimes we get lost to care, I say that jokingly. Yeah, we can work with infants up until 18 months old at times, so we can get up to 36 visits. We do offer telehealth right now, but we're primarily going back into the community and visiting in the home.
Obviously, a difficult time, a scary time for some pregnancies, and then of course when you do have the newborn, how has the response been for the folks you've been able to help?
It's very positive. We get a lot of positive feedback. I actually received a phone call yesterday from one of our beneficiaries who had nothing but glowing things to say about one of our staff. So it just was very heartwarming to hear that.
Now, if people don't have their baby enrolled in Medicaid, can you help get them set up?
Yeah, we can help with Medicaid enrollment if they're eligible. So we don't accept private insurance for the program, but if a family is Medicaid eligible and they need some guidance on how to apply for that coverage, we can help them with that.
And you could apply during your pregnancy, no problem.
Yes.
Yeah, so one of the things that I've been hearing over the years, one of the reasons we have low or not great statistics when it comes to infant health is people don't have the money. They don't go to the doctor. They're afraid they can't afford it, so they just write it out without getting any kind of help. What do you hear from families that are using the program for the first time when they didn't know it existed before?
Positive feedback. Families seem to be really satisfied with the services that they receive for our maternal infant health program, and we're designed to be a support and referral service, so we don't offer emergency services. We're not on call, on the weekends after hours, and we're very forthcoming about that and just advise, go to the emergency room if you have if you have an emergency. But yeah, we connect them with community resources, how to get baby items, refer them to WIC if they could, they're WIC eligible, if they're Medicaid eligible. Housing resources, connecting them with transportation through their Medicaid health plan. A lot of people may not realize that that is a benefit also of their health insurance through their health plan. If they need transportation to medical appointments, getting prenatal care or well child checks, we can help facilitate that.
And nutrition, that's a big deal, and one of the reasons that babies might have issues. The mom-to-be isn't following a good nutrition plan, and then once the baby's born, that's lacking there too.
Yes, we do education on nutrition, connect them with WIC services. We'll refer to dietitians in our WIC department, and we can reach out to the local hospitals as well too, if any additional nutritional assistance is needed.
How many babies come rolling through every year?
Oh gosh, well over 100. I could say that if I had to pull a number out, because I do look at those numbers every year, and we always seem to have more infants than pregnancy cases. But yeah, we reach well over 100 infants each year.
What's the biggest area of care or assistance that you see as a vital part of the program?
That's a good question. The support and just, giving these families a listening ear and letting them know we really are there to help you. We care. We want to see you be successful. We want to promote healthy pregnancies, and early childhood development and see these families thrive. That would be probably one of the biggest things.
Yeah, you're out of the hospital like in 24 hours after you have a baby now, and then you're on your own, and yeah, so a lot of times you do need help.
When you were born, and this was a great service that the hospital did, and I wish they'd bring it back, the new parents were treated to a white tablecloth steak dinner
I'm sure
in the hospital. No one remembers this but me.
I don't think that's true.
Yes, it's true.
I was going to say, are you joking?
No, it's true.
You think they're taking care of the babies and then serving up steaks?
They are.
No
they
way.
have this. This was at, which is now the Anderson Building, but at the time it was Foot East.
How old
There
am
was-
I?
You were like one
No,
day
I know.
old.
What year?
One day old.
Yeah. Jeez.
40 some years ago.
Yeah.
But and there are other people that probably remember this besides me, I hope. But the day before you were going home, they said, you're going to have no restless, you're going to be no sleep, you'll need this. So they took you and went off, and then your mom and I were in this room all by ourselves, a white tablecloth. They brought in a steak
It probably
dinner
was a white sheet.
with the metal, the lid, like in England.
The old serving platters.
Yeah.
Yeah,
Yeah, it was
the
amazing.
stainless steel, fancy. Yeah, I don't think
Wow,
they do
maybe that could be a service added to the women infant program. Yeah, we'll have to look further into that to see if any of that's true. I don't believe it's a word.
Someone
of it.
knows, please confirm my story.
Did you pick how you like the
You could
temperature
order
of the
medium
steak?
well, medium well.
Wow.
Do we have like results, statistics? Do you feel like this is the program's working in providing better health overall for new babies and moms in Jackson County?
I do. The model that we follow is an evidence-based model, and it's in conjunction with the state of Michigan. They oversee the services that we offer, and there are maternal infant health programs all throughout the state. It's not just specifically to Jackson. We're just fortunate enough to have this program here. It is an underutilized program, so we're regularly trying to educate the community about the services that are available. And getting families to participate.
One more thing about the steak dinner. Brandon, you were born at Foot East, weren't you?
Yes.
Yes. So, and I know May and Dave, your parents watched the show. So, Dave, do you remember the steak dinner? I bet you do.
Maybe they didn't get one because Brandon is the second child, so maybe the steak dinner only went to the first.
Oh, I think that was all the kids.
Really?
Yeah.
Okay.
You could bring your remaining kids, and they would watch them too.
I'm sure they would. One more time, the maternal infant health program, and you can find more information out by visiting the health department website, calling, or visiting the QR code. You may be eligible for the program and you just don't know it.
Great to see you. Thanks for coming on the show again today.
Thank you for
Thank you.
having me. Appreciate it.
Ann McClure from the Jackson County Health Department. Coming up next, Dr. Wadwa from Pulmonary Clinics. Stay tuned.